NASW conference about basically about who we are, the division that we are starting up, the goal, and our purpose for our homeless people who've been suffering through the pandemic. So for today, as the year went by in a couple of months, we would like to share with you what has been going on, what we've been doing, and progress through our division of OHAP. So as mentioned, this is my director, Ms. Sarah M. Thomas-Nededog, together with me, the social worker for OHAP as well. We have other staff that we will be talking about soon in this presentation. Next slide. All right, so what have we been doing so far? So our daily obligations with OHAP is, of course, we do a lot of village homeless outreaches where once we get referrals from either the Mayor's Council of Guam, the Office of the Governor, or other party agencies, we then do our houselessness assessment to see what services are they in need of, and not including homelessness, so that we can try our best to do a wraparound services for these individuals. And as we connect our referred clients to services, we see how there's other preliminary effects that comes with homelessness and not just homelessness by itself. For example, substance abuse, disunification from family, and also untreated mental health behavior that also plays a role in houselessness today. We also do a lot of scheduling appointments for temporary or permanent homeless IDs that was just newly established this year, together with DMV and our party organization, the Guam Homeless Coalition. We are also currently providing temporary placements with the help of the Emergency Rental Assistance Program under the Department of Administration. And this program has been helpful with our emergency temporary placements, because as we place our clients in these temporary placements, we're then able to advance in our case management work, where we see what documentations do they need, what kind of food stamps they need to expedite with, what insurances they need to apply with, like Medicaid. And as soon as we keep them in a temporary placement, then we work on permanency, where we try to find a place for them to see if that can fit them using Guru services or even extension of the ERA program if we have to, which will connect with another 15 days. My favorite part of the work, of course, are the village outreaches, because when we do our outreaches, we see the reality of how many people out there were impacted by the pandemic. And this is not just the stereotypes where homeless people are those who are drug abuse or alcoholics. No, these are homeless people that you would not expect to be homeless, people with great jobs, people with income. And all it took was really a cut of hours, a death in the family, disunification from family to have them on the streets.
Thank you, Arthur. That's a good summation of the work that OHAP does on a daily basis, but we can't do anything by ourselves. It has to be in conjunction with the myriad of government agencies and nonprofit organizations. Some of the ones that we've worked very closely with over this last year, especially, is DISIT, the Department of Integrated Services for Individuals with Disabilities, the Guam Department of Public Health and Social Services. That includes Child Protective Services, Adult Protective Services, the Division of Senior Citizens, all under DPHSS. A big shout out to Arthur Sinagostine and Terry Uggan and Lori Duenas, because they are just truly awesome, as well as their staff there. Guam Behavioral Health and Wellness Center, Teresa Ariola and Jesse have been just incredible partners, and we could not have done any of the work without these wonderful people over there at Guam Behavioral Health and Wellness Center. Guam Memorial Hospital, another key partner who's always answering our calls and our pleas, and oftentimes picks up folks or gets people, GPD picks them up most of the time and brings them over to Guam Memorial Hospital, where there's screenings done there. And then oftentimes they're referred to Guam Behavioral Health. Then we have Guam Housing Corporation Angie Camacho and all of the good people over there have also been such a great resource for us and to get people into permanent housing, as has been Guam Housing and Urban Renewal Authority. As many of you know, we lost a great leader, Ray Tapasna Jr., who has just been laid to rest recently, who was the executive director there, who's just a great partner. And his deputy director, interim director now, Liz Napoli. We have Department of Administration, and Arthur talked about them. I'll tell you, ERA is the most awesome program. And a shout out to those guys, Ed Byrne and Bernie Guinness and Vicky Linmau and Jordan and all the other folks that work at ERA who are always just a phone call away. And I'll tell you, in the work that we do with this very complex group of persons that are homeless or are what we call the street homeless, we need to have someone who's right there backing us up, so to speak, and responds to us immediately. We also work with some awesome nonprofit agencies, you know, Catholic Social Services, doing what they've been doing for many years to reach out to the homeless population, as has been the Salvation Army, Sanctuary Incorporated, West Cares, SSVS Supported Services for Veteran Families Programs, and Barrel. So these nonprofits and governmental entities have worked collaboratively to reach out, identify persons who are homeless or at risk of homelessness, and have worked to get them into safe and permanent, oftentimes permanent housing. So kudos to all of you out there.
Thank you so much. And so with our daily obligations that we do, not counting working with the government agencies and nonprofit entities, we did have special projects on the way, and projects such as, or projects that we actually done already. And so one of the projects that we've done was the Johnson & Johnson Homeless Northern Vaccination Outreach, where we identified an area in the north that had the most homeless individuals who needed vaccinations during the pandemic. We were able to reach out with the Department of Public Health, especially Dr. Margaret Hattori, to have us gather all the homeless clients together as we not just gave them Johnson & Johnson homeless vaccinations, but we were also able to create a little mini passport to services where we were able to have some of our agencies together to see what other services they need other than housing. And that was really great because we got to see our focal point, our focal area of the people within the houseless population that needs more support. Another project that we've done was establishing OHAP's multidisciplinary team, where we're a team of different entities coming together, talking about how we can rectify the most challenging cases that we have been experiencing, cases that we cannot work alone with. We also have come across a Two Lovers Point homeless outreach. Now, this is the outreach where most of our clientele work was from the Two Lovers Point. Guam Police Department was asking us for their help to see how we can transfer them to safer places instead of them migrating to different areas. We also did a beautification project with clients at the homeless shelters during Christmas. This was a project where we catered free services of haircuts just for any homeless client in the shelters who kind of needs some empowerment during the holidays, and especially those who are about to find jobs, job hunting, job interviews. We understand that having haircuts now are so expensive that we wanted to reach out to our homeless population by giving them free haircuts for one whole week during the Christmas season. We also did a Christmas Toy for Tots homeless drive, which was amazing. We got so many toys for our clients we were able to give it to the shelters, and just to share the love for those kids who were not able to receive any gifts. And the most exciting project that we've done this year was the rapid response team during the point in time homeless count. Now, the rapid response team was all the different government agencies coming together, one representative per, from CPS, APS, GPD, of course, OHAP, and we were able to respond to any kind of crises that was being referred to us during the homeless count. So instead of having to wait a few weeks about it, we were able to respond to it just like that, while having follow-ups the weeks after, to making sure that these clients were helped. And it was amazing because with this rapid response team, we got to experience acute cases that was not just homelessness. We dealt with cases that needed public health follow-ups, such as we had an individual with staples on his head who needed to get out. We had another person who had a diabetic foot and needed healthcare services for that. Another individual who had it was like a silver rod medal behind their head that also needed taken out. And, all of these problems was because, or issues was because, there was no follow-ups that was done. And so these clients with no transportation, no cell phone, no email, they were just staying where they're at. And thank goodness for this rapid response team, because we were able to rectify these situations and bring them to the services that they needed. And so that was where the need of services was shed a light on the rapid response team, because it shows how many other people were suffering behind closed doors without anyone knowing. The places that we visited were places like Zero Down. We also were able to go to Mount Santa Rosa in Jigo, and other Tumon as well, Tamaning. And this experience with us was great because we felt like ER nurses, but outside the hospital, basically. ER social workers, so to speak.
Okay.
All right, next slide, please. Thank you. So here are some photos. Of course, we couldn't take photos of any of our client work that we've done for confidentiality, but here's basically what we do. So in one of the photos, you see me taking some notes. What we do normally on an everyday basis is, of course, we stay in the office, but as soon as there's a referral that's needed, then we, together with outreach, we go out and we try to identify the clients that we need to locate. Once we locate them, we try to do an assessment on what further services they need from what they share to us, and we see what agencies can help them. And if it's truly a homelessness crisis, what we do is we try our best to work with the Emergency Rental Assistance Program to see if they can pre-qualify. And once they do, we can temporarily house them right away with us. And within 90 days, they're with us as we do further case management, seeing, if they need further documentations, further welfare guidance, applying for food stamp, if they need emergency food. And when they're ready, then we transition them out to a 15-month period with ERA, where we find, let's say, an apartment or a unit that can take the family or individual. And for the next 15 months, we try to find a permanent placement for them, as we also help them connect with, let's say, GURA services or Section 8. So that's basically the day in the life that we have that we do, basically. And so these are places like Zero Down, some places in the South that we were able to locate. Mm-hmm. Next slide.
There we go. We've got some pictures of our OHAP staff. You'll see we have a very small staff, actually. It's myself and, of course, Arthur, our social worker. And then we have Caratel, and who was with us at one time, Patrick Fanonia, and now on the upper right hand, in the blue shirt is Mark Crisostimo, and he's on detail from Guam Regional Transport. And then our awesome administrative assistant, Diane Garcia. So this was during Christmas. And then during the point in time, we went out to, I think that was the CPS DYA visit that we made. So, great picture. Now, I hope some of you be familiar with us if we have not yet met before. Thank you.
Next slide.
So, when we were thinking about our OHAP presentation, we thought, what is it that we want to share with our colleagues and our students and just the folks in our community? So we wanted to give you a little bit of a profile of the cases that we have seen, a little bit about the background of the people who we have found to be homeless or out in the streets. And why we thought this was important was to help give insight to who's really homeless and why are they homeless, and what are some of the strategies and policies that we can put into place to help prevent homelessness. And I think that's always an important aspect of our work, is not only doing that work every day and being out there with folks and understanding what's going on with them, but what are some of the things that we can do to help prevent homelessness in the future on our island and in our region.
And of course, in this presentation, not just us sharing to the community what we have been doing to help the homeless, but also, of course, later in this presentation, we would like to have suggestions from the community as well to ask us, what are some other improvements that we can try to do with our homeless community? You know, there's so many ideas that we can do, but of course, there's so little time between 8 to 5 that we want to get everything together. So in this presentation, also feel free to interact with us and share to us your feelings of homelessness and how, you know, your suggestions on what we can do to also better our community in reaching out to this very challenging population, but possible population to work with, of course.
Absolutely.
Next slide.
Just a little bit of background on OHAP, the Office of Homelessness Assistance and Poverty Prevention. It was not an agency, a governmental agency. It's not a line agency. It is actually a office that's under the governor's office, and it was created by executive order in October 2020. So we're going on about 1.5 years now since it was created, and we work very closely because we are under the direct supervision of the governor and lieutenant governor. We work very closely with the mayor's council and all the other governmental agencies. So we first I came on December 7th, 2020. And right after that, I was truly blessed. Thank you, Dr. Lisa Natividad, for sharing Arthur Paulino to come in to be our first senior social work student. And then later on, of course, we secured him as our first social worker for OHAP. And we then did get some outreach workers and administrative staff. Thank you. We're very appreciative of that came on a few months later. So we're going on about maybe about 9 months now where we're pretty fully staffed. We could always use additional help, but the work that we do is certainly augmented and supported by the myriad of governmental entities and nonprofits that we currently work with. So some of the things that OHAP does, and as Arthur did so well in explaining, is we monitor, evaluate, and supported programs that were secured during the state of emergency. So this all started in the state of emergency. That was really the impetus for OHAP. And then we identified gaps and barriers in services and started looking at policy implications. For example, there's really no current laws on homelessness or that guide or talk about. Some states actually have laws that say you shall not be, homeless and not be out in the streets. So if that's something that Guam or anyone in the region would come up with, well, that has not yet been determined, but it is one of the areas, and we're constantly looking at policy implications as we go about our daily work. And also, as brought up earlier, we have the multidisciplinary team consisting of human and social service entities, government and nonprofit, GPD, the police department, hospitals, mayors, and representatives of businesses. I can't tell you how vital it is. And I think this has been said throughout the conference and throughout, for those people that have been in this work of social work for years now, that nothing can ever be done alone. Everything is in conjunction with great partners. So developing and nurturing relationships is really key. Thank you.
All right, so of course with OHAP, we don't just do it alone. We work well together with the Guam Homeless Coalition, where we meet, of course, week to week, and they let us know what are the barriers and gaps to the homelessness that's currently happening, whether it be as something as getting their needing documentation for a homeless identification card, whether it be a gap in the system with how can we further help clients who do not have any identification at all, whether it be our clients at the Guam Memorial Hospital unit that needs help in their discharge planning once they're leaving the hospital, you know, and of course we get a few clients from Guam Behavioral as well when they get discharged, and how we can work together to place them with us or place them to another agency that can help them. We also work together with the Interagency Council on Homelessness in the United States, where we do have meetings to see what are some issues in the states that is relative to Guam, and how can we rectify it with the interventions that we can pull from the states, which is still an ongoing process of ideas that we're still trying to pitch out. And so, you know, part of OHAP was that with us being here for a while now, for a year, we have grown in clientele as well, you know. So basically in our temporary placements, we have about a total of 25 family households in our temporary placements, as well as about 30 single individuals who is placed with us as well. And this is a big number for us due to the limited staff that we have. But with these households that we have found, located, and was referred to us, we were able to, and we still are in the current process of helping them find some permanent placement, as well as making sure that, you know, their school-age children are going to school with GDOE. They have their latest school shots, school physicals, and we do more than just the homeless night as well. As I mentioned, as soon as we keep them into our placement, we try to help them, refer them to further services. All right, so that's basically our clientele work as well. So next slide, please.
As Arthur has kind of brought us to, who are the homeless? And people might say, you know, oh, we don't have any local people. We don't have, you know, certain people from different ethnic or cultural groups. Well, you know, our experience has been that we have really seen a great variety and diversity of people who we have found to be homeless. So there are Chamorro, there are Micronesians and other Micronesians from CNMI, FSM, Palau, RMI. And Asians and Americans. And when I say Americans, I really should have said mainlanders, people from the US mainland, and people who come from all over the world. I mean, may not be a great representation, but we do have people from different places and different ethnic and cultural groups. And where are they? People say, well, where are these homeless people? Some of us will drive by and see them at the corners of Micronesian Mall or GPO or somewhere down in Hagåtña and say, oh, that's where they all are. But really, even someone like myself who's been doing this work for a long time, I have been surprised several times to find out where people are actually, homeless people are actually living. So there's encampments all over around the island, and abandoned homes and buildings in Tumon and in other parts of the island. And definitely there's jungle areas and beaches in the northern part, but also we've gotten reports of homeless people on the beach in southern Guam. So there are, we do have folks from all over and from different groups. And there are also not just men, there's some women. And we have folks that are heterosexual from the LGBTQ community. We have young people, and we have people that are senior citizens. I'm trying to remember the oldest person that we've come across, must be like in their 80s, right? Yeah, and you know, as Arthur said before, there are people that we run into that you would not have known that they were struggling. And also some families who were traditionally perceived on island as being from the, you know, higher income, moderate income. So they're not just folks that are in the low or moderate income, but all socioeconomic backgrounds as well. So that just kind of gives you a better understanding of, you know, we can't stereotype the homeless because they're so diverse in ethnicity and gender and in socioeconomic background from different parts of the island and different parts of our region and our world, huh, Arthur?
And to continue with Ms. Sarah as well is that, you know, a lot of the homeless referrals that we get are not just regular homeless referrals. Lately, we have been getting a lot of homeless referrals with adult negligence or adult abuse. We've been having a lot of cases together with Vero, the victim advocates, reaching out, where we also help their clients with our temporary placements, and we try to help them get back on their feet together with them. And so many cases that we go through in a day's time, that a lot of times it's a godsend of why this division is here and is needed, as well as the other agencies that has been around, like Catholic Social Services, Salvation Army. Like really, since the start of this division, even when I was a student, I was able to see a change that, you know, of the homeless community on Guam. And so with like the homeless count of 2020, there was about 790 homeless clients identified. On 2021, the homeless count was 99 singles and 66 households. The 2022 homeless count is still pending, but through our experience with this count, we have seen and witnessed a lot of clients who have suffered, struggled, and have been impacted by the pandemic. And this just shows that really, even the pandemic itself was a cause of homelessness. And thank goodness for all of these CARES Act services and federal programs that also work with us to help our clients get the housing services they continue to need, for sure. All right, next slide.
Okay, so we're coming down to the end of our presentation, but we did want to talk a little bit about, you know, what are the presenting problems? What are some of the things people have told us about why they're in a state of homelessness or why they're at great risk of being very poor and being homeless, and what are some of those factors? So we wanted to share those experiences with you. And that is, you know, one of the ones that they have said over, especially during the pandemic, was the place where they stayed was too crowded or could not afford to take care of all the people in the household. So let's say you had a family of, you know, 10 people in a 4-bedroom house, and they were your in-laws or they were, you know, your cousins or something like that. During the pandemic, it was like really, really hard. Some people lost their jobs. Some people just were not able to return to work for whatever reason. And that put a great stress on the family. And so we got reports that, you know, the auntie or the uncle or the grandparents even, or cousins or who have you, said, hey, you know, we just can't do it anymore. We can't help you. And I know it's hard to hear, very contrary to who we are as a Pacific people, right? But the truth is, you know, some families were not able to continue to open their arms and welcome all of their friends and families or extended family members in. And then there were those that couldn't afford the rent, so they left their houses, their apartments, and they just came out to the street because, you know, the power was, you know, they're not supposed to be, you know, at that time, as you guys know, the banks weren't supposed to foreclose, and the utilities were not supposed to be turned off during the pandemic. But yet there were people who feared it so much that they left because they just knew they could not afford it, and they were so scared they would have to pay back, you know, all the rent and utilities for their homes that they were staying in or renting out, basically. Or they lived in substandard housing or in the streets and jungles, and they felt unsafe. And so that's when they came forward and said, please help, because I just can't do it anymore. And oftentimes we found people that had physical and emotional health issues. And they felt like, you know, I can't do this anymore. And they came forward. And the others were there, their family members had drug, alcohol, or untreated behavioral health issues. This is where a lot of people say, okay, all the homeless are druggies or alcoholics, or, you know, they're all crazy. Well, you know what? There's people that fall in the category of having issues with drugs and alcohol or untreated behavioral health issues. Yes. But what we saw also in this group coming forward in this last year were people that did not have these issues, but really had some socioeconomic issues that drove them out to the streets. Next slide.
Next slide, please. Thank you. So what services are available out there for our clients? So of course, we have the emergency shelters, we have the transitional housing, we have the placement in permanent housing, drugs and alcohol treatments that we can refer to, of course, the Guam behavioral health screening and in-outpatient services. And of course, the bulk of all the work will be the case management side as well of current services that the clients would need as they're housed somewhere, which of course we try our best to do as long as the client will work together with us on getting the work done together.
So what is lacking? We've got all these services, certainly much more than we had when I first got into the field in the 70s, but there's still areas that are lacking, like we don't have enough primary and secondary prevention efforts. And for those of you that have been very involved in prevention work, you know, that's working with people before it's a problem, or working with them when we're already seeing early signs that there's some issues in the family or with that person. You know, maybe they're already having problems in school or in the community, what have you. Aftercare, oftentimes we don't put the resources into aftercare. So after we provide help, we don't see them very much afterwards. And aftercare is so important for these cases where they have complex issues. And just, you know, there's just, this population is a tough population that really does require and need aftercare. Increased participation of early identification and referrals to supportive services. We tell all the people out there, all the people in the community, all the governmental agencies and nonprofits, anyone that will listen, keep your eyes and ears open to people who might be experiencing some struggles before it gets to the point where, you know, they get kicked out of the house, or they lose their home, or they just become so ill, usually emotionally ill or what have you, that they can't continue sustaining their household. We need translators and support from the various ethnic and cultural groups. And this is probably really key. Focus on family reunification. How can we keep our families together? That's so super critical. And getting them back together, get to a point of forgiveness and love and kindness and all of that good stuff, but getting them back together and helping support them so they stay together. Outreach and services in the streets and in the villages. So many agencies tell us, we don't do outreach. We can't go out there. We need agencies and organizations to do more out. There's a bunch that are doing some already. We need more, and we need to expand that.
Especially with the pick count this year, we realized how many outreach services are needed for our clients, because many of the times our clients do not have transportation, right? Many of the times they don't feel comfortable to be in a big environment in a huge building. So many of the times we try our best, if we can, to get the services and to take them with us to see the clients, so that also the services can see exactly the reality of what the client is going through. You know, the abandoned building they're squatting at, you know, the area they're in with no water or power, not even maybe like a tarp for a house for them, you know. And more outreaches and services to go out to the community can help these clients see that, you know, what can we do to accommodate your needs instead of the clients accommodating the services needs, of course, you know, because, you know, as a community, we have to make sure that our clients are comfortable with the services that we can provide to them and are willing to do with them, of course. Thank you. So next slide. All right. So, thank you so much for, your hard listening. I know we did a lot of story time, but now it's time for us to, be open to any questions and comments that, this group have. So any suggestions that can help continue empower our division will be so great. Thank you.
Hello.
Hi.
Hi, Arthur. Hi, Miss Sarah. So my name is
So,
Julian from Behavioral Health. I had a question. In the 2 years or so that OHAB has in place for those who eventually obtain housing and placement, what is that timeline has been for OHAB from the time that you receive the individual from intake to a placement, whether temporary or permanent? What have you guys been experiencing?
and are you asking how much time does it take from intake to placement?
Yes, Miss Sarah.
Oh, if we can do it in 4 hours,
Yeah.
I'm serious. It's the truth. We have to move rather quickly with this population because it's oftentimes a matter of life and death, life or death. So, I mean, um, for example, Arthur or the outreach team might be out in the field and they will let me know that they, found let's say a family that has a child that's 2 years old, 10 years old, and 15, 16 years old. The minute we find them, we've got to find a place for them because we don't want to go to sleep that night and know that they're out on the street somewhere with no food and no shelter. So really, within hours, we will find a place, and sometimes it's actually been where we get a taxi to take them because it's after hours and there's no transportation. And we will take them to a hotel and find resources to pay for that hotel, but we don't leave them out on the streets. We just don't. If we come across them, we do everything we can. And, the question is always, are they safe out there, wherever they're at? Let's say we come across someone at 7 or 8 o'clock, and, that will always be the question. Wherever they're at right now, are they okay? If they're not okay, we're going to move and get them into some shelter immediately.
So for like a client case example that we were able to help rectify was we came across a referral of a family of 11 at a beach. As soon as we found out the living situation, we brought over one of our liaison agencies that has the ERA program, and we brought the ERA program to the family to get them pre-qualified and assessed. As soon as they were able to get pre-qualified that same day, we were able to locate a temporary unit for this family of 11, where instead of separating them, we kept them together. Throughout this time period, within the 90-day periods that they have, we try our best to see what are other services in the case management side that they need help with, what documentation they need, what other welfare they need. So good news for this family was that they had all the documentations needed, they had all their welfare needed. Really what it was just a little push back to normalcy, to finding a place. So with this family, they're still with us within the 90-day period. And what we've been doing was having them apply for different housing programs or even affordable housing places under Guam Housing. Um, because from what the head of household will always share to us is that they're ready to move back to normalcy. They just need that little push for them. So for give or take, it can take about 90 days. And if they need a little bit extra push, let's say they try looking for a job, no employment, they need a little bit more time to get their documentations ready. There will be a point of time where as long as we can place them in a more permanent area, like an apartment unit, using the ERA funds, then it can last for another 15 months, 1-5. And then from there, so that's the interesting about us is that we're still in stage two. Stage two in meaning we place them temporarily. So now we are in the process of leading them to permanency, which is still in the works.
Yeah, so the short answer to that is we try to address their homelessness immediately, especially if there are some safety issues, and especially when it comes to children. You know, are some very high risk or vulnerable populations. We will do whatever we have to do to get them. But to meet the goal of permanent housing, that might take several months to make sure that happens. And as Arthur was saying, one of the biggest problems that we've become very well aware of in this last year or so is documentation. It's incredible how many people don't have birth certificates. And sometimes it requires us to go off island and go to the council generals or the various councils and consulate office to ask for their help because they have no documents, their birth certificate, and other things that are important for them in order to get to move into permanent housing. So very good question. Thank you.
Thank you, Ms. Aaron. Thank you, Aaron.
Any other questions or even any concerns you have with the homeless community that you've been noticing?
Or any comments that you might have out there. We're very open to hearing. We're constantly learning, right? Yeah. Every day about new strategies, old strategies, yeah. Absolutely. Just things that will work to help to move our people into a safer place.
I know some questions out there might be, how do you guys do this with a team of 5? Well, we've been learning to really use our networking skills to a good, and to social work students who are watching this, now is the time to start connecting yourself, being familiarized with the other agencies because they will be your best friends. And this is not the profession where you want to burn bridges. This is the profession where you want to keep on rebuilding and connecting those bridges together. A lot of our clients that we've gotten has been the veterans lately. And so what we've been doing is, once we are able to pre-qualify them with one of our programs, and we take them into our temporary placement, then we work together with the SSVF program West Care, the veteran advocates, where they come out with us and talk to that veteran, and then they are able to process them in their program together with the VSO. So a lot of the times, as long as you know exactly which agencies will be best for this client, then it will make the job easier for us for sure. Yes, bridging the gap and using our resources. Thank you so much, Cabrini. That's something that we are always addressing, that as an agency or as a division, we can't do things alone, because if we do, then it'll be hard to get the work done, really. And so to all the agencies who are watching this, whether it be DISIT, Guam Behavioral, GMH especially, and Public Health, thank you so much for supporting our division, just continuing helping our clients who we're helping right now. Any other questions?
Thank you so much, Ms. Sarah and Mr. Arthur, today on your presentation. Great job. Thank you so much. I learned a lot, actually. And if you guys are too shy to ask any questions or any comments, you can also just leave it on our chat here.
Yes, we welcome any questions or comments. You know, you might not think about it now, but you might wake up tomorrow morning and go, oh my gosh, I have a question.
I got one question.
Oh, okay, there you go.
Yeah, okay. Yeah, Mark Paris from DOC.
Hi, Mark.
We got clients that are born off island, right? If they manage to get their birth certificate, you know, a certified birth certificate from off island, is there a system in place where they can register it here on island so they can go back and get it anytime, just in case they lose their birth certificate and not have to contact California again and do all the legwork just to get their birth certificate?
You know, Mark, every state and every territory has their own different processes. Right. And so some of them are really easy. It's a phone call and it's, you know, whatever you pay, whatever the fee is, and you can get it right away. And so sometimes it's like pulling teeth. So we've been especially challenged when we have people that are from the various countries around in Asia, you know, Philippines, Korea, China, and trying to get birth certificates from there. But it's generally easier to get it from if they were born here on island or in the US mainland in Hawaii. It can be challenging again if they were born in other parts of the Pacific, but everyone has their own, you know, their own policies and procedures about, you know, getting birth certificates. So, you know, I can only imagine that for you at DOC is, you know, when they come in, it's like, get that from the beginning and keep it on file because it's going to come in handy at some point, right?
And thanks for addressing that issue, because that's another gap and barrier that we're having with our clients too. So we're not perfect. A lot of times too, it's hard to assist our clients who are not born on Guam, especially those who have come from Vietnam or in the States, because like you said, the birth certificate is the key factor to the services for sure. And so of course, that's something in our gaps that we're trying to fill in as well. So hopefully we can have a solution for that in the further future. So I see some hands raised. I see
Thank
Mr.
you.
Nathan Javier. Nate?
Javier? Hi,
Yeah, that's me.
Nate.
I'm one of Dr. Lozama's students, so I just wanted to ask, what's one of your objectives on the homeless population for maybe the next 1 or 2 years, or if you have an idea for your objectives for like the next 5 years?
Well, I would say first and foremost, we want to reduce the number of people that are living in encampments and living in the jungles around the island. That would be one. Two would be to expand the number of service providers, governmental agencies, nonprofits, and private businesses to educate them on what are some of the risks of homelessness, and for them to identify internally what is it that they can do to contribute to reducing homelessness on Guam within their families, within their organizations, and just within the island and the region. What is it that we can do? So everyone, we would just love it if everyone, all the families, all the organizations would answer that question themselves. What is it that I can do to reduce homelessness on Guam, in my family, in my village? You know, so that would be another one. And then three is to have all these programs that we still don't have, to have those instituted. We talked about it a little bit earlier. What is it that we are lacking? And so those be like the three key things. Thank you for the good question.
Yeah, thank you very much. I remember you were talking about how you were stressing family reunification, and
Yes.
I mean, I think that's pretty great because that's one of the pillars in reintegrating these people back into society. So that's pretty awesome. You
Yes.
guys are great.
That was actually one of our biggest key factors in the very beginning when we didn't even have the emergency rental assistance on our side. In the very beginning, I remember when I was a student, one of my very first client cases was, how are we going to provide a home to someone when we have a lack of resources ourselves? All it really took was having the client give us a list of family members who we can call. And there was this one client, right, where it took us 10 family members in Guam, and all of them said no, rejected us, saying, why are you going to help them? It's their choice. Not understanding how severe their homelessness was. And I remember, I'm not sure, Mr. if you remember this, but I almost gave up. I saw one more number from the States and I said, you know what? No, if these 10 family members are not going to do anything, what makes you think someone from the States will? And I was a student. I was losing hope until I called that, you know, Miss Sarah would say, just try, just one more time, just one more step. And I did. I called that family member in the States, and I remember that family member was able to provide a month worth of housing for the client, as well as when that 1 month worth was over, they were able to buy a container home for that one individual with the girlfriend, kids, on their family ranch. And that was what my concern was. It really was the child that was experiencing homelessness at a young age. And that experience was what kept me here in this division when something as simple as family reunification can really come a long way. And you don't need the high technology or the latest services. You really, if you can call the family, try to help them understand, empathize what the client's going through. That's all it takes. So thanks, Nate, for addressing that.
Yeah, thank you for your answers. You guys are great.
We have a few more questions in the chat, and I don't want to.
I don't know
Yes,
that
there are a few more questions. Oh, we have 4
have
questions.
to
Yeah.
answer them because we'll try to be brief, and we'll leave our phone numbers so that you know, and our contact information for those that we don't get to. But we'll just take your lead, Janice.
Okay, so we have one from Ms. Vera. She was asking, can we be given a copy of the referral, please?
So what we do basically is we have the constituents give the concern to the Mayor's Council of Guam, and Mayor's Council of Guam will know what to do. So if you have a homeless individual that you know needs help, you can go to the nearest mayor's office, give them to them. Mayor Savars, Mayor Hoffman, Mayor Alec, they will make sure that they address this to us, especially from the Office of the Governor.
All right. I hope that answers your question, Ms. Vera. And then the next question is from Paulina Duenas. It's, would you be open to internships for students from GCC to obtain credit?
Yeah, I love students. We both love students. Now, Arthur came to us as a student, and now he's a full-fledged social worker. So we love students, and it really, you know, we'll go through the interview process. And I'm pretty sure at GCC, as it is at UOG, there's a process. So you need to just go to your advisor and then connect with us, because we're excited and would love to have students come and join us. I think it's a great experience, definitely.
Awesome. All right. And then we have 2 more questions. The first one is from Tasi Onget Martinez. So for those who are experiencing homelessness, how has OHAP helped homeless individuals obtain documents such as birth certificate and social security card? And would you be able to share with us how you helped a homeless individual obtain a document despite barriers like payment? Like an example, birth certificate.
Oh my gosh. Well, those are good questions. And we talked a little bit earlier about our multidisciplinary team. Guam Memorial Hospital, Rev and Tax has been one of our most awesome partners. I don't know if we've mentioned them before, but let me tell you, Rob at the Lieutenant Governor's office, and Art Meno at the Department of Rev and Tax with their director and deputy director, Marita Zama and Daphne Shimizu. Those guys are awesome. So when we need something like that, we go to them. And if there's a cost and there's something that the person cannot afford, we figure it out. So we don't let that $10, $20 fee get in the way. We will find the resources. If it be donations from other people, we go to the Homeless Coalition. We go somewhere to get that money, but we don't let that become, you know, a reason why someone doesn't get the documents that they need. Because, you know, as you know that these are usually very, very important things that they need to move forward, is to get these things in place. So between, you know, getting birth certificates at the hospital or getting anything at Rev and Tax, it's just been a nice collaboration.
And we have been very fortunate that we do have family who are willing to help the clients pay for documentations that are needed. Like I said, a key role is really family reunification. Before you doubt, just try it out, because I'm telling you right now, oh yeah, I did. Sorry.
That's very good.
So yeah, you know, because a lot of times we understand that as social workers, we cannot pay for the services for the client. And so to make sure that's not an ethical dilemma, for me, I would truly humble myself. I would call, like I would tell the client, give me a list of family members that you're close to or distant to. Let me call them and let me see how I can encourage them to help the client. And mostly all the times, the family members are willing to pay for their family member for their documentation. you know, and a lot of times it's because they wish they can keep them in their house, but due to, of course, GOR regulations, overcrowding, they can't oversee the capacity that their units for. And sometimes too, the client will find a way, whether it be getting a job, whether it be extra money that they would find.
Okay. So what is, I see another question that's popped up. Would you be able to share with us the various types of temporary housing and placements that OHA has utilized? Previously mentioned housing at hotels.
Sure.
Yeah, so right now, I'll tell you the biggest, strongest, and the support that we have is the Emergency Rental Assistance Program, ERA, that's being managed by the Department of Administration. And their staff has really helped us tremendously. We have to often look for a place, a temporary place. Sometimes it's a hotel. Most of the time it's actually a hotel. There's several that we've been working closely with that we can call them up at 9 o'clock at night and say, hey, we need a room or we need 2 rooms for a family, and they're very good. And then they say, we'll worry about, you know, whatever we need to do to get, you know, payment or get ERA involved. And oftentimes, gosh, I think it's about 2 or 3 times a week lately, you know, we've had to call and ask them to please meet us out in the streets somewhere to do interviews. I'm telling you, our agencies have been awesome. They know they got to get out of the office and go out in the field, because some people, as Arthur said earlier, are not going to come into these buildings. They've got PTSD, they're intimidated, or they don't feel like they're properly dressed, or they just feel very uncomfortable going into, you know, GPA or to the ITC building or wherever it is. So we have found quite a number of hotels or smaller places where we will place them temporarily until we can go get them into permanent housing.
So, like, to answer further too, so what we do normally is step 1, of course, is outreach. We try to we locate the client that's referred to us. As soon as we can pre-assess them that they can qualify with the program, then we get them pre-qualified with the Emergency Rental Assistance Program. Once they're pre-qualified, as long as we get a go from them, then that same day, we're able to temporarily place them somewhere for the next 90 days. Within that 90-day time period, then we do some kind of case management where if they need expedite a food stamp, we can try to provide that. Emergency food, we can. But let's say they have food stamp. Let's say they have insurance already, like Medicare, Medicaid. We try to encourage the clients that, you know, we don't want to do everything for you, but we want to help you get back to normalcy. So of course, if they have food stamp, we teach them, okay, you have food stamp now. Let's start having a budget so that you can have some food coming over for your family, so you can cook at the unit. Most of the units that we can provide has a kitchen. And if they don't have food stamp anymore, they ran out, whatever so reason, then we can provide the emergency food later. But really our goal here is not to really be run like a shelter where we feed them 3 times a day, but to help them, empower them by going back out with us, just, you know, they're guardian angels, like how I say it, you know?
Yeah, thank you for the good question.
Okay, I believe we have one more question. From Jennifer Cruz. Can we have a contact number to collaborate on emergency housing, especially for after hours assistance?
I think that, let me see. Oops, can you get this? Okay, so in our chat, you do have our numbers. Those are generally regular work hours, but if you message us, you can get us right away at any, because we both check our messages. We check our messages frequently and throughout the night. But please message us if you need to get a hold of us. Arthur's going to put our cell numbers up here too. There you go.
For after hours, with that can sometimes be a challenge as well, because there's always going to be some units that will be saying, can they wait for the next morning? Can they wait for the next morning? So in that kind of situation, we'll have the client say, of course, if you can, stay within that area, and then we'll bring you to the ERA to try to see if we can pre-qualify you and then to place you there. But there's many times that we were able to help them after hours, for sure.
And the question is always, as I said earlier, are they safe where they're at? And if they're not, then we will move and get them into some place immediately. Was there another question?
Yes, another question popped up on the chat. It's from Vera. She said, regarding homeless individuals with disabilities, what are barriers you face and solutions you found?
I would say almost everyone that we have come across has some disability. So we work closely with DISID, with just various providers who have a commitment and expertise in working with people with disabilities. But we have, oh my gosh, we've seen so many people, unfortunately, that are unable to walk, have definitely have had some health issues. We've had, remember the one gentleman that 60-some years old and had a stroke. And as Arthur was talking about some of the cases, some of them are older people who have a multitude of disabilities, and even some younger ones who have behavioral health issues. So people with disabilities are really, have good representation in the homeless population, unfortunately. But we do work closely with those agencies that specialize in working with persons with disabilities, including our good friends at Gumamami, as well as, all the other nonprofits, Sanctuary, West Care. All of them have that commitment and constantly developing their competencies and skills in working with people with disabilities.
And so with the barriers, a major barrier with our clients and individuals with physical disabilities is that there's not enough ADA housing units on Guam to help them. Even though this helps us with, let's say, an ADA housing voucher, sometimes that's not the solution sometimes, because it's what other ADA housing areas can we find them in? And of course, we have to make sure all the housing areas and units are ADA compliant. The few of our people with physical disabilities, we were lucky to find an ADA compliant area for them, and that's rare. And so for a solution with that is we are hoping to hopefully address more policies like that, where more ADA housing units on Guam, and I believe Guam Housing is looking into that.
Sure. And really, the temporary housing that we do have, and we work with ERA on, emergency rental assistance, all of them have to be ADA compliant. So we're constantly looking for, and we would not, generally place anybody into a hotel or temporary or permanent residence that wasn't ADA compliant. So it's just as Arthur said, it's a challenge because we work with the realtors too. And sometimes the realtors say, we only have a second floor and there's no elevator. I was like, oh, this person, that's not going to work. So constantly looking for, realtors out there that can help us find appropriate housing for people with disabilities. Just like in all of our other programs in the field, it's always a challenge, but it can happen. Thank you.
For solutions, Vera, just don't stop looking. And I know that's cliche, but that's so true. Just don't stop looking.
Be surprised. Sometimes the most, awesome answers or people, emerge to help. So we got to reach out and nurture our relationships all the time, not just when we need people and businesses and nonprofits and partners, but we should nurture our relationships all the time because they will definitely come in handy. Thank you, everyone. I think we kind of went over our time, but it was such an enjoyable afternoon, and just love NASW for continuing to do the conferences despite, having to do it in the alternative formats like this. And prayerfully next year, we're all going to be together and hug and get to see each other, right? Face to face. So si Diyos Masi, all of you out there who have participated in this concurrent session with Arthur and I.
All right. Thank you so much, Ms. Sarah and Mr. Arthur, on your presentation today. We'd just like to also thank everyone for joining us for day one of the 2022 Social Work Regional Training Conference. And as a reminder, the conference will resume tomorrow morning at 8 a.m. And to access the conference, you can use your same Zoom link, and we look forward to seeing you tomorrow morning. All right.
Thank you so much, everyone.
Thank
Be
you,
safe out
guys.
there, please.
Have a
Thank
nice
you.
evening.
If you know someone who's homeless, do not be afraid to call a referral. It just takes one phone call. That's all it takes. Thank you.